From KUNC and the NPR network, this is In The NoCo. I'm Erin O'Toole. Using psychedelics to treat postpartum mental health disorders. Nearly 1 in 5 new moms experiences anxiety or depression during pregnancy or after giving birth. If left untreated, these conditions can lead to difficulty bonding with a newborn or a higher risk of suicide. But a new experimental treatment is giving some researchers hope. It's called luvesilocin. It's a psychedelic substance derived from mushrooms. In a recent set of FDA trials, a single dose of luvesilocin turned out to be highly effective and work more quickly in improving patients' postpartum depression and anxiety. Dr. Camille Hoffman is an OB/GYN and a professor of maternal fetal medicine at University of Colorado Anschutz, who was part of an early clinical study. She joined me to talk about what researchers found and why luvesilocin may be a promising alternative to psychotherapy or prescription drugs that are often used to treat postpartum depression. Here's that conversation. Camille, there are some existing treatments for postpartum depression or anxiety. What are some of the drawbacks or the limitations of those medications?
So the limitations are they still take some time to really have an effect or for people to respond. And I'm talking a month, 6 weeks. They're not rapidly acting during a time of life when that is really important.
It's worth noting the trials were small. Yes. I think just 84 people total, right. 10 participants in Denver. Help me picture what the experience was like for one of them. Where did they take the treatment and what was their day like?
So they'd already had 2 preparatory sessions with one of the session monitors who was going to be one of 2 people sitting with them throughout that treatment day to help them have a breathing practice, really be able to lean into the experience and glean the most out of it from a set and setting perspective, which is one of the mantras of psychedelic therapies. Then in our spaces, they were designed to be not too clinical, so not too sterile, but also not too psychedelic or too artsy, so that the situation and the setting wasn't really influencing them in one way or the other. It lasted on average a little under 4 hours. There was no consistent thing that they saw. They would be able to see kind of experiences that maybe they'd had even during pregnancy or earlier in life, or sometimes after their baby was born. Some of them had more kind of ancestral or experiences related to early childhood or familial patterns or behaviors that then they were able to kind of take a step back and say, hey, this might be a way that I put up boundaries or a way that something that is in me as part of my childhood or upbringing impacts my ability to connect with myself or my baby or my partner. But they were able to take a more objective view of that after going through these sessions.
So what did the participants in the study experience when they took a psychedelic?
They definitely weren't experiencing rainbows and unicorns the whole time. You would watch them sweat. They would struggle. They would grimace. Sometimes they would cry. I think they would come out on the other side talking often about wanting to get home to their babies. They felt like their sense of wanting to connect with their babies and their family members had been heightened in that short time period. Their moods had been lifted. Their feelings of compassion for themselves and kind of self-empowerment assessments that we did also improved. So it was an all-around beautiful thing to witness, but it wasn't something that during the experience looked entirely pleasant.
Without getting too detailed, how did the treatment affect the postpartum symptoms of the moms who took part in the study?
The treatment and the microdose to some degree both improved the postpartum depression symptoms very rapidly. In the 1-day data, there was already symptom improvement. At 7 days, which was kind of the major time point of focus for the study, there was dramatic and statistically significant improvement in symptoms and in what are called remission rates, or really cure rates of postpartum depression and its symptoms.
Well, very dramatic results. What about new moms who are breastfeeding? I'm just wondering how, safe a treatment like this is in that situation.
That's a great question. So in the FDA phase 2 trial that we did, we actually did not include anyone who was still lactating. They had to have weaned, so breastfeeding was not included. However, at a different study site, healthy volunteers who were still breastfeeding were recruited. I think the company, Reunion Neuroscience, who funded this study and who created luvesilocin in the first place, are waiting to hear back on what the FDA says as far as how long someone will need to abstain or potentially pump and dump one time.
Well, what makes you hopeful after this particular study?
One of the things that makes me most hopeful is how rapidly it acts. And even if we know we need more information on luvesilin and postpartum depression specifically, we also know from a large database of other psychedelic studies that they do have pretty long durability, meaning one session lasts for a long time, even in people who have more chronic mental health conditions like treatment-resistant depression or PTSD. So unlike other conditions in the mental health space, the timing and critical need for rapid resolution of postpartum depression is so much different because an infant is so rapidly changing in their life. And we know that the mom's mental health is a major player in how that baby's health, including physical and mental health, is going to develop into their teenage and adult years. And so the more rapidly you can improve that for the mom, you're really improving it for both, for mom and baby. So to me, being someone who's very passionate about the perinatal space and the importance of these relationships on how our overall health in our lives unfold, it's such a perfect time period to have a rapidly acting therapy that improves this condition so quickly and so much.
That's Dr. Camille Hoffman, an OB/GYN and professor of maternal fetal medicine at the University of Colorado Anschutz. She spoke with me about an early clinical study of a new psychedelic treatment for postpartum mood disorders called luvesilocin. She wrote about it for the online publication The Conversation. We'll have links where you can learn more in our show notes and at KUNC.org. And just a reminder that we publish all of our interviews for free. You can find recent In The NoCo episodes on how to stay healthy when wildfires are polluting Colorado's air, or why the discovery of tiny fossilized primate teeth near Colorado Springs has scientists so excited. Find all of our episodes at KUNC.org or in our feed on your favorite podcast app. That's it today for In The NoCo. I'm Erin O'Toole. Thanks so much for listening.